We're going to do a Robert Jones bandage to stabilize a fractured limb. To prepare for it, you need to get rolled cotton, and it comes in 12-inch, so then you'll just separate it with your hands into thirds. I've already started separating it. And then once you've separated the whole length of it, you can re-roll each strand so then you have the rolled cotton to work with. We're going to pretend an open fracture. So we have our wound here over our fractured bone, and we would wear gloves to clean the area, just like review the modified Robert Jones videos. You clean the wound the same way. And we're going to place a sterile primary layer, which is our Telfa pad. And we're going to pretend that this lubricant is our ointment for the wound. Place that over the wound. We're going to put stirrups on our patient, just as we would with the modified Robert Jones. We would never put the stirrups over the wound or over the Telfa pad. So if you need to use the dorsal and palmar surfaces of the paw, you can use that as well. So we have our stirrups placed and a tongue depressor in between. And then the secondary layer of a Robert Jones is going to be the rolled cotton, and you're always going to start on the distal limb for small animals. And we have our two center toenails sticking out, which are digits 3 and 4. We want to be able to check those for any swelling. And you're going to wrap firmly with the rolled cotton with about 50-50 coverage up the limb. And with the Robert Jones, it's not the prettiest of bandages. It's difficult to get it to lay entirely flat. But we do want to make sure we have enough padding. So we're going to try and enlarge the width of the leg by like 2 to 3 times. So this is not quite enough for this size dog. We'll do a little bit more. So this is to keep the limb immobilized while we're waiting for surgery to fix the fracture. So we don't want the limb moving around, making the fracture worse, causing a lot of pain every time that fractured bone moves. So it's going to be a thick padded bandage. And you go up above the elbow, so all the way up into the axilla. Okay. And then the first part of the tertiary layer is going to be the rolled gauze. And here we're going to compress. So this is very different from the modified Robert Jones in that we're now compressing down as hard as we can because we have a lot of padding, but we're going to be tightening our tertiary layer as much as we can down on that secondary layer. So we may need to do several layers of rolled gauze to really compress it down. So it's kind of difficult to do. So you're trying for that 50-50 coverage. You can see if you're pulling tight, it does cinch down. And again, it's not a very pretty bandage. It's kind of lumpy bumpy. It's like that marshmallow man from Ghostbusters, yeah. And with the rolled gauze, make sure that you do have space between the skin and where the rolled gauze ends. We don't want the rolled gauze on the skin. So we have that secondary layer still uncovered there. And then we're going to do another layer of the rolled gauze. And same thing at the bottom of the bandage. We want to make sure that you don't have the rolled gauze touching the skin. If you did have an animal that had a complete fracture, you need to be careful that you don't start rotating the bandage when you're tightening, because you could end up putting the foot on backwards. It literally can happen. It would just, you'd be rotating the distal limb while the proximal limb stays still, and then you're obviously causing a lot of pain doing that. All right, so that is the rolled gauze. And then once we have the rolled gauze on, we're going to reflect the stirrups. And so this is when you can check to make sure your foot's still on the right way. If you haven't noticed already that it's turned around. And then you're going to do your vet wrap. This is still part of the tertiary layer. And again, this is the one time you're pulling really tight. You would never pull tight on a modified Robert Jones. With the Robert Jones, we're trying to compress the secondary layer, which is very thick. So we're actually getting all of those wrinkles that are in the vet wrap out. So it's going to look smooth and shiny when we get it really tight. And it's 50-50 coverage. Really cranking down. And make sure that the vet wrap does not touch the skin. Gonna finish it out going distally. As long as you start from the distal aspect of the limb and move proximally, if you need to then move back down distally to finish out your layer, you can do that. Okay. And then once you have completed your bandage, it should sound like a ripe melon. You shouldn't really be able to squeeze it when you're compressing. This piece of cotton up here that didn't lay properly, you can just cut that off. If I had scissors that actually cut through things, it would go faster. Okay, tear the rest of that off. But you could make it look pretty, and then you can take elasticon and you can protect the bottom of the bandage with that. You're going to have to take them out to urinate or anything. And keeping those two toenails exposed so that we can check to make sure we don't have crazy swelling going on. And you never want to pull the elasticon tight because it's a lot like the vet wrap. If we have it on the skin, it's going to end up irritating the skin as well as cutting off blood flow. So at the top of the bandage, we can place it there as well. And we're just laying it flat, not pulling on it at all. And that will protect the top of the bandage and might help prevent it from slipping a little bit. But